Welcome, everybody, to this edition of the Glad Longevity Podcast. I'm your host, Dr. Jeffrey Gladden. And as you know, this podcast is devoted to helping you answer 4 questions. How good can I be? How do I make 100 the new 30? How do I live young for a lifetime? And how do I crack the code on living beyond 120? How do I live well beyond 120? And we've come to understand here that if you're focused on the questions and not the answers, you'll continue to make progress in your quest. And to that end, today I had the opportunity to interview two guys that have a very large following on their podcast, Daniel Cheng and Alexander Kidd. And they have been on a quest to interview leading longevity and health experts from around the world. And it's a really nice mission that they're on because they're really looking to democratize health and longevity for the planet. We got into their personal stories in a way that they may not have shared before with you, and also some of the things that they've learned in the process of interviewing all these people. I think you're really going to enjoy this show. It was a great conversation.
This episode of the Gladden Longevity Podcast is brought to you by the new Gladden Longevity Anti-Inflammatory Shroom Formula.
A little background, our anti-inflammatory formula is a potent blend of adaptogenic mushrooms specifically designed to support your body's natural defense mechanisms to reduce inflammation. This unique formula contains a powerful mix of medicinal mushrooms, including agaricus, reishi, cordyceps, and maitake, known for their immune boosting and anti-inflammatory properties. Together, they do a great job of turning down a major driver of inflammation.
I've been a big fan of adaptogenic mushrooms for a number of years now, and I was really excited to find you all were coming out with this. This is a superior product to what I've tested on the market.
Yeah, we love it, and our clients love it as well. Again, this is a tincture, so we will put it in tea, we'll put it in a smoothie, we'll put it in water and drink it. But to know that you're actually able to decrease NF-kappa beta, which is a major driver of inflammation in your body with this, it just goes along with everything else that we know about aging, that inflammation is a key driver of the aging process. So we love going straight at the heart of it with this formula.
Get 10% off your order of the new Gladden Longevity Anti-Inflammatory Shroom Formula when you use the code podcast10 at gladdenlongevitysshop.com. That's podcast10 at checkout when you visit gladdenlongevitysshop.com.
Experience the power of adaptogenic mushrooms with our anti-inflammatory formula and embrace a healthier, more balanced lifestyle. Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here with Dr. Daniel Cheng, PharmD, and Alexander Kidd, not a PharmD. So, guys, welcome to the show. We're excited to have a conversation with you. You've been doing a lot of really interesting interviews, I know, with many people that are kind of in the healthcare space, the functional medicine space, the longevity space, the health and life optimization space. And I think it'd be really fun to first kind of get to know you a little bit individually and then kind of learn from you kind of what you've been learning. So maybe, Daniel, maybe we'll start with you since you're on the left side of my screen here and we go left to right as we read. So anyway, Daniel, tell us a little bit about yourself. You have a PharmD, so that means you were involved with pharma at some point, but now you're on a different trajectory. Maybe you can share with us kind of how that happened.
Yeah, for sure. So it's interesting. I was very sick as a child, and I spent a couple weeks in the hospital after I was born,
Mm-hmm.
and then seeing lots of doctors, a lot of skin issues, energy, fatigue problems, and so I went
Was that
into
like through your entire childhood? I mean, did that start like when you were 3 years old or 5 years old or 2 years old or 12 years old, or when did that kind of kick in?
yeah. I think when my mom always tells me when I was born, I was like very low percentile weight
Mm-hmm.
wise, and was very sick. So they had to put me in a incubator for a
Mm-hmm.
little bit. And then when I came
Yeah.
out of the hospital, I had skin problems and I had asthma. So I'd say since I was born, and it's kind of been up and down
Yeah.
ever since.
Okay.
And then just getting worse and worse into my teens, then 20s.
So you would what get the flu, get colds, stuff like that easily? Is that what you're saying? Kind of like an immuno compromised scenario, or
Exactly. Yeah. So I would be very sensitive to things like dust.
Mm.
And then anytime I was overactive, let's say I went on a hike or I
Hmm.
wanted to lift weights, if I overexerted myself, I would end up with the flu symptoms for the next 3 to 5 days.
Interesting. Okay. Yeah, that's interesting. So your immune system is both hyperactive and also kind of hyper responsive in a way that we know that exercise in general tends to transiently depress the immune system for most people, but then it sort of bounces back stronger, right? Just like other systems in the body. So it's interesting. In your case, it kind of got depressed, but then sort of stayed depressed. So it's kind of almost like the whole thing is hypersensitive in any direction, right? The allergies, the asthma, and then also being compromised by exercise and things like that. So interesting.
Yeah, exactly. I couldn't make heads or tails of it because
Hmm.
I thought that exercising would help me feel better, but
Sure.
then it didn't really if I did it too much of it. So it
Right.
was a very weird balance I had to figure out.
Hmm. Interesting. Um, and how is that for you today?
Today it's a lot better. I think I finally have gotten to the root of it. Would love to get your thoughts, as
Yeah.
a as an expert.
Yeah.
But yeah, I tried everything over the last 7 years. This diet, that diet, this detox, this product. I think I found the root cause.
Okay. What'd you find?
Okay, so do you want the short answer or the long answer?
Let's start with a short answer.
Short answer is heavy metals,
Okay. Okay.
which cause
So
a cascade of all sorts of things.
Okay, so you had heavy metal toxicity, and I suspect that genetically, you've probably looked at this and see that you may not detox from heavy metals very efficiently. Probably some compromise in the detox enzymes as well as glutathione, and that led to lots of excess oxidative stress and put a lot of pressure on your whole system, quite honestly. So,
Yeah, because from what I understand, metal um, displaces all sorts of minerals in the
mhm.
body, right? And it basically
Yeah,
destroys every organ.
yeah, it does. One of the primary issues with metals is that it does increase oxidative stress in the body, which, to your point, starts to destroy other systems, right? So, and what it does is we have a natural defense against that, but when you overwhelm the system, right, it's kind of like then all of a sudden, you can have waiters in a restaurant, but they can handle 50 people, but when they have 500 people, the whole system falls apart. And so that's kind of the analogy for you. As to what happened in a way. Yeah. So how are you getting the metals? They can come from lots of sources. You can breathe them, you can drink them, you can eat them. Uh,
Yeah, so I did eat a lot of tuna as a kid,
okay.
but I
Some
believe the
mercury.
main, yeah, which is tons of mercury, and I believe the main cause was amalgam filling that I got removed.
Okay. So that's such an interesting thing because there you are. You've got a very sensitive system, and then which is can be modulated quite honestly. But you got a sensitive system, and now you're dumping your own every day, every night, amalgam in there that's basically bleeding into your system. So interesting. So then you figured out that mercury was an issue, maybe other metals as well. So then you probably had the amalgam removed and put in a
Had it
different.
removed, yeah, by a holistic dentist,
Beautiful.
and then I waited 3 to 6 months before I started chelating,
Yep.
which is what I did next,
Mm-hmm.
and then I basically did. I think I've done like 50, 60 rounds of ALA and DMSA
Mm-hmm.
according to Andrew Cutler's protocol. It was pretty
Yep.
harsh,
It's
pretty
pretty
intense.
harsh. Yeah, it's pretty
Yeah,
harsh. It's pretty harsh. One of the things that we like for detox, which you think is gentler, is actually doing a lot of saunas and using some things that actually are can chelate metals a little more gently. Because when you go down the route of IV chelation or even the oral protocols, you're pushing a lot of stuff out through the kidneys, which can be have its own stress, right? And so you can be doing a good thing, but actually aggravating the stress. Whereas with a sauna, um, we excrete through three things. We excrete through the urine, the stool, and the skin, right? So getting it out through the skin, good amount of surface area, and sweating it comes out naturally, but at a slower pace. And we find that to be amazingly effective. It just takes a little bit of time, 3, 4, 6 months, but also much gentler on the system. So, yeah.
Yeah, I can testify for myself that sauna definitely helps because
Hmm.
there's been nights where I haven't been able to sleep because I've been so itchy.
Yep.
But once I get in the sauna, it actually makes the itching worse, for a little bit. But then once you sweat it all out,
That's
you're
it.
able to
Nice.
calm it down. So
Nice.
it's a great method. I would like to ask you a question since we're on the topic.
Yep.
A lot of people, when we share content about saunas, they say that you don't really excrete toxins through the skin. I think that's like the general public's opinion, but they just may not be aware of. So, like,
Yeah, I
are
mean,
there
it depends
studies
on what the
showing?
toxin is. It depends on what the toxin is, right? You're not going to get rid of viruses through the skin necessarily. Some of the things end up being bound inside the body, and it's more difficult to actually get them out without doing something more dramatic. But in general, for most things, it's actually a really good way to detox. So that's kind of how we tend to think about it. But
I mean, Daniel, can you share some of the photos of your skin detoxing?
Yeah. What do
Um,
you?
yeah,
If you'd like to
we
see,
we don't know if we want to sicken your audience, doctor, but
no, that's all right.
let's.
This is all audio only, so we're going to see it and describe it. Um,
I want
but
you to describe it.
yeah, so the other person chatting here is Alexander Kidd, who is also works. They work together. Daniel and Alex work together. Basically, they were on a mission to, as I said, really kind of uncover from experts around the world the way to optimize life, longevity, health, performance, etc. So. Um, Maybe before you show your pictures, Daniel, Alex, do you want to tell us a little bit about how you got into this? I know you've been a lifelong devotee of
Yeah, I
things.
have a similar origin story as Daniel, right? And from a young age, when my mother gave birth, the hospital was on strike. And I only give this backstory because I don't know if it really has any issue with any correlation to me being ill. But they didn't autoclave the instruments. She got some type of virus disease, whatever. She went into a coma for a week. They had to remove
Wow.
me. And that's kind of where it started. At 6 months old, I had very heavy asthma. It was so bad that I got stuck in Argentina for about a year until I was well enough to get on a plane to come back to the States.
Hmm. Well,
And from there, that's just my story of like constant hospitalization, constant antibiotics,
hmm.
whether it's strep throat or whether I had a collapsed lung at some point,
Hmm.
so I was hospitalized as well. And that was basically my youth was always being sick with one thing or another. Asthma attacks. At the time they didn't really have nebulizers and things like that, but as
Right.
that started to be introduced, a lot of prednisone, right, for inflammation, a
So
lot of
prednisone is a
albuterol.
steroid, is what he's referring to, just for the audience. Prednisone is a steroid. You may know that, but it basically blocks inflammation, but then has a lot of negative side effects to it. So if you use it chronically. So anyway, sorry to interrupt you, but just to
I mean,
make
I had
sure.
cataracts from and remember, I'm just pushing 50, right, and I've had cataracts for the last 15 years because
Hmm.
most likely attributed to the prednisone, right.
Yeah. Yeah.
um, so as that went on, as I got older, I just kept adding autoimmune disease after autoimmune disease. Psoriasis, psoriatic arthritis,
Mm.
ulcerative colitis, sinusitis. And on and on and on. And this was like again, collecting these diseases are not fun, especially at a young age. Remember, I'm still under 20 at this
Yeah.
point when this stuff is happening to me. By the time I
Yeah.
was 30, I was in a wheelchair for a short period of time because the
Mm.
psoriatic arthritis was so bad I couldn't even stand up. My hips, my knees were like totally, blown
Yep.
out.
Yep.
And until I met this Dr. Majid Ali. All right, he was a pathologist turned naturopath, and I'm on at this point. I'm meeting this guy. I'm on methotrexate,
Yep.
right? Getting
This is
tested
another drug
monthly.
that basically blocks the immune system activity. All this autoimmune disorders are typically treated by drugs that will suppress immune system activity. And the side effect is it makes you more vulnerable to infection, but it tends to calm down the overexcitement of the immune system, if you will, with regards to all the autoimmune diseases, rheumatoid arthritis, psoriatic arthritis, etc. So.
So then from there, they moved me on to Enbrel, right, with what
Yeah.
subdermal injection. And I said to myself, I'm 30 years old and I'm 30% better, and the doctor's telling me, well, that's pretty good prognosis, you know. And he's like, but
Yeah.
by the way, don't kiss anybody, don't get a tattoo, wash your hands 30 times a day, because you may die from catching another disease. And I thought to myself, how am I going to live another 30, 40, 50, 60 years on this planet, in
Right.
this condition, right? So after meeting Dr. Ali, he said to me, I'll never forget this. The first question he asked me is like, "Are you addicted to sugar?" And I said to him, "No." He goes, "Great. For the next 30 days, no dairy, no wheat, no sugar." I said, "No problem." I was like, "But I can have strawberries." I get no, no sugar whatsoever. I don't think I lasted 5 hours, and that's when I realized the world I was living. And then from there, it just became an issue of cleaning up my diet, right? And that mission continued to go on as, I thought I was healthy at 30, but I wasn't. Then learning more and more about diet, then learning more and more about these drugs that I was taking and whatnot. And, Dr. Ali promised me, he's like, within 30 to 60 days, he goes, I'm going to get you off all these drugs. And he did, right? And that was the first piece of it, was the diet, right? Learning that.
Yep.
Then,
Exactly. This is a great point for the audience to understand that when you have autoimmunity, the first place to look, there's really kind of two things that we look at. Is one is the diet, the second is the gut, right? So sort of simultaneously is what we're looking at. But the diet is massive here because the immune system, particularly if you're eating the same thing all the time, or even if you're not, if the immune system is set up in a way where it's sensitive to wheat or gluten or gliadin or any of the proteins that are actually inside wheat, it doesn't even have to be gluten, right? There's like 35 other proteins in there. Egg whites, there's many, many proteins that you can be allergic to. So really cleaning up the diet and doing comprehensive testing to see where's the safe path here? What can I actually eat so that I'm not activating the immune system? Becomes part of the equation here. So super important to go down that path. Interesting. Yeah.
So that brought me to about 95%, functionality,
Mm-hmm.
right? I still didn't have that last 5%.
What was missing? What was missing?
So, it's an interesting question because, Daniel and I are still on this quest, right? To bridge that gap of that 5%. And I'm not sure, but I know in the last year, I've made massive strides in that last 5%. Right?
Okay.
Where, further cleaning up the diet, further doing tons of testing for heavy metals, chemicals, glyphosates, fungus, all this other stuff, then finding out that I am toxic in certain ways that I never realized before, right?
Yep.
And, so do I still have a little bit of psoriasis? Yes. Does my UC ever flare up? No, but underlying when you do biopsy, it's still there. Right. So These are the things I'm saying. Like, I don't feel 100%.
Yeah. UC is ulcerative colitis, just to remind the audience. This is inflammatory bowel disease is referring to here. So, yeah.
Yeah.
Go ahead.
And then that brought us on this journey of microbiome, right? Where like over the last 2 months, I did a test on my microbiome and got a custom blend, which I think is making strides as well for me. I'm feeling much better. Right. Good. Also, I've always tested myself saying, oh, how's my vitamin C? How's my vitamin D? Standard things. But doing deep dives into really looking at testing and figuring out, not just taking a multivitamin or blindly taking vitamins for your deficiencies. So that's right. Also made a huge stride.
Yep. Yeah, this is what you're talking about is precision, which is really what we kind of practice here at Glad Longevity and continue to expand on, every day, every week, is how do we actually understand somebody deeply? Because before you can start to propose solutions, which when you went to your doctor, you have psoriasis, okay, here's our answer. We're going to give you, methotrexate or Enbrel to basically calm your immune system. But there's no deconstruction of the problem to actually understand what is causing this, right? And so what we like to do, and I think what you guys have discovered as well and are validating for yourselves, is that it's so important to fully deconstruct the problem as thoroughly as possible and to continue that, because new testing comes up, new capabilities come up, and things like that. So this mindset of I want to deconstruct myself as completely as possible so I can have the best solutions going forward. That's kind of the mindset that you've come into, which is, really the mindset that anybody that's interested in health and longevity, I think, should adopt. So kudos to you guys. I mean, you've both kind of fought through a hard path to get to that point. So that's very cool. Yeah.
And I think a big part of it is, I met Daniel. We were both marketers. We were both, health driven in the health space. And, we learned all this stuff, I guess, by accident, by researching, by meeting, great people like you. And we said, how do we democratize this information and get it out to the rest of the world?
Yep.
And that's really our basis and why we do this, is that we want to make sure that everyone else does not suffer the way we did, or worse yet, slowly kill themselves, but to never realize that there actually is a way to be healthy. Because nowadays people think being healthy means being rich to be able to afford this, medication or whatever. And that's not the path, man. We've lived for thousands of years. We've made it here as human beings, but yet now is when we need all this stuff. Doesn't make sense to me.
So I'll just add that, when you're looking at getting healthy, people are always looking at, well, what should I take? What should I do? What should I add? But quite honestly, the first thing to do is what should I remove, right? The first thing is what should I remove, both from the diet, from the toxins, from the metals, so really, if you're listening to this and you're not doing well, the first question to ask in this deconstruction issue is what's in there that I need to get out or need to stop putting in, right? And then the question becomes, okay, now what can I add that will actually help me in a very precise way? Like which vitamin do I actually need? Which mineral do I actually need? So that you can do it in a precise way. And you're only able to get to that when you kind of go through this deconstruction process to understand it. So yeah, cool.
Yeah, and I can testify to that because there's so much going on in our bodies and in our lives that it's hard to really narrow down what's causing what. So I myself, what I did was I cut I cut out everything in my diet. I limited it to maybe 3 or 4 things. I think I had like sweet potato and broccoli and beans or something at one point.
Okay.
And then I saw how I reacted to that. And then I added other things, and then I added more.
Yep.
And then when you really reduce things down as simple as possible, you see the effect of every single item.
That's right. Yeah, that's right too. And I think it's easy to not trim it down all the way, and then it's easy to get a little ambitious when you feel good again and start adding in 6 other things, and you don't know which 2 or 3 of those are actually re-triggering stuff, right? So a lot of wisdom in being a little bit slow and methodical in the way you kind of reintroduce things. So cool.
I think what's also important to highlight here is, Daniel and I both suffer from autoimmune disorders, which are similar in nature, but I feel like our root causes are completely different.
Yeah.
Right?
Yeah. Have you done the genetics to look at all that?
We haven't gotten there yet.
Okay. So we should definitely do that for you guys. You should swing down to Dallas when you come down and let us do some stuff to deconstruct this further for you, because that will be super helpful, quite honestly.
We'd love to make an episode on that. That'd be great.
Yeah, that'd be great. Let's do that.
When you say genetics, what do you mean? Because we've looked at methylation. Like, is that part of that?
Yeah, I mean, when you do your genetics, when you say the word methylation now in the longevity space, it can be one of 2 things, right? You can be looking at DNA methylation, which is basically a pattern of adding these carbons with 3 hydrogens onto the DNA that either activates a gene or deactivates a gene. So that's DNA methylation. Then you can talk about the methylation cycle, which is the genetics that are involved in the genes that are actually performing methylation in the body. And many, many, many people, myself included, have issues with that methylation cycle. And everybody talks about one particular gene, MTHFR, which needs methylfolate as opposed to just folic acid in order to function properly. But it's much more complicated than that. There's about 7 or 8 different things in the methylation cycle that need to be deconstructed. Those genes need to be looked at. And then getting the right amount of B12, the right amount of B6, the right amount of creatine, the right amount of other things, as well as methylfolate, to optimize that methylation process, which is basically how you're both detoxing, making melatonin, making neurotransmitters. It's kind of a central process to many, many processes in the body. So getting that one right is super important. So when we talk about genetics, we're talking about what are the genes inside the methylation cycle? What are the genes related to autoimmunity? What are the genes related to cardiovascular disease, to dementia, to thyroid optimization, how people respond to different statins drugs, or how they, do they have issues with detox genes that aren't working properly, and particularly which ones of those are not working properly. Because the interesting thing is that when you deconstruct at a genetic level, which is really kind of the foundational level, right? And you guys are, it's interesting, you're kind of like miners, you're kind of like strip mining your way down to genetics, right?
Yeah,
So when you get down to that level, you're really now at the base level, right? This is my genetic code, and then the issue becomes, okay, well, how do I actually modify my genetic expression? Because the genes are not fixed. They can either be activated or deactivated. They can be upregulated or downregulated. And so once you actually understand that and you start to play the piano here, right, it's like, okay, well, let's upregulate this and downregulate that because that's going to have an impact on this, which will have an impact on that. And it starts to work its way up to the different strata that you guys have already worked through. It becomes foundational. So that's how we think about it, if that helps.
definitely. Yeah. Thank you.
Mm-hmm.
Are you ready for my picture, by the way?
Yeah, I'm ready for your picture. I'm standing. I'm not sitting down, but maybe I should. Okay, no, you can share it. Oh wow, yeah,
That is human skin.
that looks pretty nasty. Oh yeah, very nasty. It's showing us a really nasty looking rash on his neck. That it's coming through a video too, but it's wrapped around his entire neck. It almost looked like he has on a turtleneck on the front that kind of goes up onto the side of his face. So that's pretty nasty. And what actually was causing that?
Yeah. So this was when I was on a round of ALA and DMSA.
Oh, okay.
And
So you had a Herxheimer reaction and you had a detox reaction from that, right?
yeah. And
Yeah.
I was had a 105 fever. I was in bed for a week
Yep.
and shooting nerve pain up and down. So,
Yep. So
um,
here's the thing: when you detox, you can detox too quickly, right? Again, you can overwhelm your own system's ability to handle it. We see this with ozone saunas and IV ozone treatments. You can throw somebody into what's called a Herxheimer reaction, where they detox. And sometimes, quite honestly, that can be because they actually have really good detox genetics. And now you throw this into them and they're detoxing so quickly that they're generating all this stuff. It doesn't always have to come from somebody that has poor detox. So this is why you really have to understand your genetics before you start doing stuff like this, right? You can see how foundational that is. So, you guys have kind of stripped, mind your way down to the genetics. We actually start with the genetics and build the structure back up, like you're building a house, right? So,
I wish we knew you before we started then.
yeah, would have been
We could have
helpful.
saved ourselves some help.
it was very
Well,
painful.
and
Yeah.
the funny thing is
Yeah.
Daniel and I will do different things. Is Daniel always takes the hardcore approach, and takes those pills and almost kills himself. And then I walk to the sauna, and I do the sauna for 6 months. And again,
Yeah,
we all have our own approach, but that's what we do. On the show,
yeah,
we test this stuff out.
yeah, yeah, exactly. Well, I love your enthusiasm for this and your ability to try things because ultimately, even with all the information at hand, it's still let's try this and ease our way into it and see how this works. That's always going to be part of the equation, right? So,
I,
so yeah, it's you have to have the mindset of um, I'm working on this to really deconstruct and really understand it deeply, and then I'm working with things that uh, are indicated or appear that they should be super helpful, but let's see how they actually work together, right? So,
I'd
yeah.
love to share my journey on how I deconstructed it and get
Okay.
your feedback on my thinking process.
Yeah.
So at the time, I was, getting lots of rashes, very itchy, very tired.
Mm-hmm.
And so one thing I noticed about myself was I had a very white tongue. So pretty obvious.
Candida.
I'm like, Candida, that came to
Yeah.
mind. So I said, okay, the problem is Candida. So I went on a Candida diet, cut out all sugar and carbs,
Mm-hmm.
lost tons of weight. People said I looked like a cancer patient. And and it did help temporarily until it didn't anymore, and then my symptoms came back.
Mm-hmm.
So I started to dig even more into what could be the root cause, and then I found out that parasites create a environment that is hospitable for candida. So
Mm-hmm.
then I said, okay, maybe the parasites are the actual root problem that are
Right.
causing this cascade. So
Right.
then I went on parasite cleanse, black walnut, clove, all those things, to clear out the parasites. Did tons of enemas, and and that helped too until the rashes came back. And so then I determined, all right, okay, that must not be the root cause. So kept digging and digging, and then I realized um, I, that I had this feeling, and then it clicked in my head because I saw something about how heavy metals actually create a biofilm that protect parasites from being killed. So then, um, to me, I'm stepping one step further. So now heavy metals is the root cause that's feeding the parasites, which is then feeding the candida. And so if I get rid of metals, then I should be able to clear everything. So that's basically been the journey. What
Okay.
do you think about that whole process? Am I thinking about it properly?
Yeah, I think you are. I think you are. In our world, what we do is we test for all of that up front, so that we don't have to work our way through that, but we actually see what are the metal loads, what is the detox capability, what's the parasite load, what's the gut SIBO overgrowth, what's the small intestinal yeast overgrowth, right? Do you have candida? Do you have fungus? We have testing now that enables us to, with looking at DNA in the blood, to identify over 2,000 different um, infections that you would never find any other way. Um,
Wow.
yeah, it's super interesting, right? And so when you come across a situation like this, where somebody has all this autoimmunity going on, it's so important to deconstruct it as completely as possible right from the get-go, because otherwise you keep working through these layers that are partially working but not totally working. If you just can lay it all out to begin with, it's like, oh, okay, well, here's 16 things we need to go after. Let's start to go after them, right? And you kind of build it from the ground up as opposed from the top down. So that would be my only comment on the process. That if we had worked together from the beginning, that's how we would have done it. And quite honestly, we have more capability this week than we did 3 weeks ago in our ability to do that, right? Because in our practice, we're constantly asking the questions, as you know, how good can you be? How do you make 100 to the new 30? How do you live young for a lifetime? And how do you crack the code on 120, right? Live well beyond 120. So when those questions are at the forefront, we're constantly finding new things to do that are helpful in the deconstruction and in the therapeutic process. So anyway, that's the deal. Yeah. So you've been chatting with a lot of people, and I think you've learned a lot of things in this democratization. We're doing this podcast as a democratization of things that we have come to understand and want to share, or people like you have to share. So, what are some of the other things that you have come across that you found to be helpful from the guests that you've interviewed on your podcast?
Daniel and I are two people that are very willing to admit we're wrong and very willing to change our path, right? We're
Nice.
never going to fight for a side, right? And I think that's
Yeah.
what makes us very unique. Um, you know,
Super good.
we started off, having a certain type of diet, moved into another diet, right?
Yeah.
Daniel tried keto, this and that. Right now we're walking on this line about being vegan and not being vegan, right? And understanding, because when I went vegan, I saw a huge change in my autoimmune disorders. But
Mm-hmm.
looking back now, was it because I just had a much cleaner diet, or was it the vegan diet that did it, right? Because I know that, like, being vegan long term has issues with possibly Alzheimer's, right? There are other issues because you're not getting your full B's and stuff like that. And when I
Yep.
look at you know this voyage we're on as a human being, we're all about longevity, right? You're about longevity. Our channel's about longevity, and it ties into every other piece, right? So
Mm-hmm.
also uncovering, what are the optimal ways to be a human being, not just avoiding the microplastics and the glyphosates and all this other stuff, right? So, being on this journey of doing our best to understand the basics.
Yeah. So when it comes to all the things that we're learning, we're basically incorporating them into our life. Vegan versus carnivore, and like trying to find that balance between
Mm-hmm.
everything.
That's right. And the interesting thing is, everybody that you speak will make a case for their particular view, right? Like, and I think this is one of the problems. when you jump on YouTube and everybody's talking about, well, if you take these 5 supplements, you're going to live forever. If you want to reverse your age by 20 years, take these 2 things or do this one exercise or whatever it is, right? And I smile at that. I look at it from the standpoint, oh, maybe there's something here that's helpful. I look at it and it's like, okay. But at the end of the day, if people are really going to do this, they're going to need to deconstruct and then reconstruct. And I think, the fact that you're trying these different things as people come in and say, well, it's all about being carnivore, it's all about being vegan, it's all about being nutrient dense, it's all about being pescatarian, it's all about, whatever, Mediterranean, it really, that's all fine and well, but it really boils down to what works for you. And so you can actually figure out some of that based on genetic testing as to kind of and immune system testing as to what's going to work for you. So anyway, interesting. Yeah.
Let me try to recap this if it's better. Again, the thing we learned is that there's no magic bullet, right?
Right.
And although stem cell research is happening and there are a lot of breakthroughs, everything you need to be healthy and live long is in the palm of your hand. It's here today, and it's basically free, right?
Yep.
Sure, there's those needle movers that may add another couple of years to the end of your life or, help you get there. But without, basics of good mental clarity, good clean diet, good healthy, I don't want to say exercise, but, movement, community, right? These basic fundamentals that everybody has access to.
Yep.
That's the key to longevity. That's what we've learned, at least thus far.
Yep. And I think you're right, particularly when you when you measure it against the blue zones, right? When you look at all the different elements that are present in the blue zones, and when you look at their diet, it's very nutrient dense. They're getting lots of things that we don't ordinarily get. For example, in Sardinia, they have very high levels of a new essential fatty acid called C15. Which turns out they have, it makes up a percentage of our red blood cell membrane. The membrane is made out of lipids, right? The cell membrane is made out of fats. And so it's a small percentage of the membrane that's made out of these fats. But in the blue zones, 0.4 to 0.6% of that fat is the C15. In normal healthy populations, it's 0.2 to 0.4. But in many of the people that we test, it's down at 0.1 or 0.09 or 0.06, right? And this correlates directly with longevity, right? Because it actually is more powerful than rapamycin in terms of promoting longevity to have elevated C15 levels. And it's really interesting, and you get it from dairy. And yet we know that so many people don't do well with dairy. They actually get it in Sardinia from eating cheeses that are high in C15. But then we have so many people that can't eat dairy, right? So being able to know what your C15 levels are and optimize them becomes really, really important. So my point is that, yes, all those basics are important, but there really is another layer that can really boost that, I think, significantly if you understand it. And to your point about stem cells, I think if we're really going to crack the code here, there's going to have to be regeneration. It's not going to be enough to have a healthy, super healthy lifestyle. Because everybody that did that still got older, right? And so to rejuvenate, right, either by DNA methylation rejuvenation, stem cell rejuvenation, there are many, many tools now that we're using to do that, right? So young plasma and embryonic cell factors, which calm the immune system beautifully, quite honestly. So there's lots of things that can be done on the regeneration, rejuvenation side. And I think coupling that with a super clean diet and lifestyle, and I think the mental space, the psycho-spiritual space, optimizing that, I think then you really have your best shot at living your best life.
Yeah, to add to that, yeah, I really do agree that the body is amazing, and it can, if you get out of the way, it can do everything it needs to heal itself. But it's just that we're so overloaded with toxins that the cards are stacked against us. So
that's right.
It makes it really, really hard.
Yeah, it's a really good point that you make up because we live in a toxic environment, right? It's a very toxic environment. Trying to get clean air, clean water, clean food, nutrient-dense food is a very hard thing to do. So, and the other thing that I think pollutes us is toxic thoughts, right? I've kind of come down to the realization that all of life really kind of boils down to one thing, if you will, which is how you optimize your nervous system. which is, the decisions you make, what you choose to eat, how you think, how you feel, how you respond, how you connect. If you optimize how you move, if you optimize your nervous system, right, and think about going through life as I'm here to optimize my nervous system, right, then everything else will sort of flow from that. And so that's become sort of my centerpiece. I'm a cardiologist by training, but I've had to leave the heart. The heart's important, but the nervous system is the ticket. So yeah.
The mindset is, like I said, if we can take the top 5 things that experts have taught us on the show, mindset's always the number one thing.
That's right.
For sure.
For sure. Yeah.
Yeah, for the
Beautiful.
nervous system, we've been working with a doctor who I think for the first month, all he talked to us about was breathing,
Yeah.
and I didn't understand it at the time because all he did was 5-5 breathing every day, 20
Yep.
minutes
Yep.
at a time, it didn't make any sense. But after doing it, I saw how it started to rebalance my nervous system,
That's right.
and then that started to affect my digestion and energy and everything. So,
And sleep.
Exactly.
Sleep
And sleep.
would be
yeah,
Exactly.
mad
Right.
swapped, yeah. And
That's
it's
right.
funny because Daniel was sleeping 12 hours and I was sleeping 4. Again, we're like
Okay.
polar opposites.
Yeah.
And I came into the 7.5 hours, and I don't know how he's doing, but
I'm coming
again,
down. So I'm back
yeah,
down to normal hours. Yeah.
Okay. Interesting, right? So it's just for the audience to understand. It's one thing to focus on all these things. Well, what should I eat and do and exercise, all this stuff. But really, if you sort of look at the meta analysis of all this, is really to optimize your nervous system, then all these other things sort of flow out of that. And that's a really cool thing, I think. So, yeah.
yeah.
Well,
And I just want to highlight
yeah, go
is
ahead.
that to the audience is that the tools are within their grasps.
Yeah.
That's the whole thing
Yeah.
that we want people to understand.
Yeah. Yeah. And I think that's a great message. And I think it does take some money to do some of this testing for sure. And those prices are coming down. But to Alex's point, you can do so much, and there's so much available. Just listening to stuff and trying some things, right? So that's what you're saying. Yeah.
Yeah.
Cool. Very cool.
To answer your previous question about what are some of the favorite things we've learned from
Yep.
experts, you know, not really silver bullets, but I think things that have been actual needle movers for me are one, melatonin,
Yep.
making sure that it's bioidentical,
Mm-hmm.
and just taking a tiny, like one like
Milligram.
milligram, yeah, like
Mm-hmm.
tiny amounts, has really helped. I think not only with sleep, which is what most people think about, but it
Right.
actually chelates heavy metals. It actually helps power your mitochondria, all these things.
It
So,
balances your immune system also and decreases inflammation. And I'll tell you something else about melatonin is that melatonin goes down as we age. And having higher melatonin feeds a stem cell, a particular stem cell that we have in the third ventricle, in the lower lateral wall of the third ventricle of the brain by the hypothalamus. And that's believed that those stem cells are actually controlling the aging process because those stem cells are sending out signals, exosomes to the body, keeping them youthful. And when those stem cells start to fade, they can't send out those signals and it accelerates the aging process. This has been shown over and over again now in animals and things like that. So melatonin actually keeps those stem cells vibrant and alive longer. So using melatonin is super healthy for all the reasons you said, but it's also getting at one of the true root causes of aging, if you will. So it's really interesting. Yeah.
wow, very cool.
Yeah.
Another one is GHK copper peptides.
Yep.
I've been using it topically.
Okay.
There's also these patches. I tested it out for a couple days. Pretty cool, but just topically, I've been using it twice a day,
Yep.
and I was starting to get these very deep 11 lines right here.
Yeah.
You can still see a bit of a remnant of it, but after using it, it made such a dramatic difference in my skin.
Nice. Yeah. GHKCU is wonderful for wound healing, skin repair, hair regrowth. It's used in that area as well. We use it to heal other things too, in combination with another peptide, BPC 157, for let's say somebody has a bruised muscle or a broken bone or tendonitis or something like that, or a recent surgery. That combination works really, really well to accelerate the healing process. So that's very cool. And there are patches that supposedly, I think it's what is it, X something 19 patch. That will increase GHKCU. We've used some of
39.
those. Yeah, yeah, exactly. And then you can get a number of different products now have skin creams that have GHKCU in them that you can get also. So yeah, very cool. Okay, next.
Red light, that's been a favorite of mine.
Okay, tell me
Um,
about that.
yeah, so yeah, I have a what is it? I think a Platinum LED is the company that I bought from.
Okay,
Just based upon the test, it seemed like their output was the best, the wavelengths and the amount of power. Um, and it's been great, especially in the winters when you're not getting sun, to just help
yeah,
you feel energized and keep you like, yeah, keep you feeling good.
nice.
And I think it also helps the skin. I've noticed.
Yep.
My neck here is quite rashy from all
Mm-hmm.
the years of the mercury going through. I think since it was right here, basically all this whole area, including my sinuses, very very congested, inflamed.
Mm-hmm.
And when I do red lights, I notice that things start to mobilize, starts to get itchy, and so definitely energizes the cells and helps them detox.
Yeah, interesting. Yeah, it's great. It also activates mitochondrial function, which is really good for health. Nice.
Yeah. So, ooh, something else. Oh yeah, when it comes to detoxing, two products that I've used have been really good are zeolites,
Yep.
and I just recently found out about this company. They make a micronized chlorella,
Oh yeah.
um, and it's called NDF, and it's those two have been really good as well in helping me
Yep.
detox.
So yeah, zeolites are basically they're kind of like from clay in the earth, really. Then and they basically are good binders and will take things out. The combination of spirulina and chlorella together is also very good for detox. And chlorella on its own is good for detox. And this micronized chlorella probably has greater surface area for that. One of the other interesting things about spirulina and chlorella together is that they increase genetic expression of a gene called klotho. And you probably have come across klotho. Klotho is basically a gene that's associated with longevity. It's associated with improved brain health, heart health, kidney health, blood vessel health, and having optimal klotho levels, I think, is really critical. So here, we're able to measure klotho levels. We're able to look at the genetics around klotho, and then put people into situations to optimize their klotho expression and increase those levels. And one of the things that we use to do that is a combination of spirulina and chlorella that come in these little tablets, almost like little pellets, like you'd feed a rabbit. Just throw those back. Thor's hammer is a good one simply because it's very, very cost efficient. There's very expensive ones out there, but Thor's hammer seems to be a really good price point, accessible. And we've gone through their process, and it's quite good from what we understand. So yeah,
That's great. Yeah, I do have some these tablets here, but
yeah, that's what they look like right there. That's it.
yeah. But
Yeah,
like you said, they're quite pricey, so I'll definitely check out
yeah, yeah.
Thor's Hammer.
So yeah, those are quite pricey that you have right there. But Thor's hammer is like a third of the price. So, and I just I'll swallow like 14 or 15 of them at a time, right? It's also a great source of protein. Here's another thing: if you were locked in your house for or your home for 30 days and all you had was those pellets, you'd walk out of there okay. I mean, it's that nutritionally dense. They're amazing. Yeah, incredible nutritional support. So yeah.
Yeah, more protein density than
Hmm.
steak
Yep.
per
Yep.
gram.
Yep. Yeah, no, they're
Yeah,
good stuff. Yeah, we like that. We put a lot of people on those because of the detox capability. It's gentle and yet it's sort of very nourishing, right? So yeah, good, cool. Well, you guys are doing great work. I really appreciate the work that you're doing, the mission that you're on. And we had a chance to meet at a meeting maybe a couple months ago for the first time. I really enjoyed it speaking with you and having you on this show. So that'd be great. And
Thanks for having us.
yeah, absolutely. Yeah,
yeah,
I'll look forward to connecting with you in Dallas when you're down here. So that'd be great. Show you what
definitely.
we
Yeah.
do and yeah, see what we
Last
can
time
do
we
to be
spoke, we
helpful.
only had I think 20 minutes, so it was pretty rushed. Let's
Yeah,
do a proper session this time.
yeah, yeah. We can do that. I'd be happy to jump on your show and we can walk through a whole bunch of stuff. So that'd be great.
I
Good.
think also, Daniel and I are producing a docu series, right, where it's going to be longer format, and
Yeah,
we're going to be following, beginning to ends, right?
yeah,
Whether they're patients or processes or doctors like yourself that are doing things. So be great to maybe have an episode based on you and what you
Sure.
guys are doing.
Sure. We'd love that. Yeah, we'd be happy to do that. Yeah, we can take it from A to Z on almost everything. So what we find is that each person kind of charts their own path, right? And so it's really important. I think it's really important to be working, if you are working with a physician or a nurse practitioner or whomever it is, that they have an open mind, something that I call being married to the questions and not the answers, right? Because a lot of people will walk in and they've got certain answers on the shelf behind them, and they're just looking at which one are they going to give to you. But this concept of actually deconstructing the problem before you provide a solution, that's who you want to work with, because those people are not binary thinkers like, okay, here's a problem, here's a solution. They're actually quantum thinkers. They're looking at, okay, here's a sphere of all possibilities. What's going to be the best for this person at this point? Where do we start and how do we move through it? So you want to be working with quantum thinkers, which is what you guys are. You're looking at this holistically. It's not there's a binary thing. And the fact that there's no ego involved with this, right? That you're willing to admit, well, we made a mistake. We're the same way. It's like, we're not perfect, of course, but it's we're just married to these questions, and we want to bring this forward to humanity. We want to change the course of aging for the entire planet. So working together with guys like you is just, it's just perfect. So appreciate that. Yeah.
Thanks for having us on. We love it.
Yeah. Awesome. Thanks for being here. All right.
It's great to have a guy like you as a friend. So let's keep in touch. And
let's do that. All right. Have a great day.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.